Hello, everyone. Welcome to Lump Basics or the Lump TCM and Acupuncture for beginners. We are now on episode 62. First, we talk about the water element, where we discuss the backache, trigeminal neuralgia. Backache, this is most common problem among acupuncture patients. So we have the table that shows the types of pain and treatment. Okay, let's start with heart pain. Worsens with activity, better with rest, severe radiating to the leg, eased by leaning forward, sitting, or lying. If the pain is very localized, bleeding cup should be considered. So as you can see from the tower diagram, you could the yang of the urinary bladder is quite elevated. So we have to sedate the urinary bladder by using points bladder 65 and 60 or 63. We vibrate SI7, 4 local points with electrostimulation, bladder 37, 40, and 60. So another situation is where you have a subacute situation. Here you could see that the yin is deficient. Okay, so you have to sedate the bladder 63, vibrate SI7. We use kidney 4, the luo point, 4 local points with electrostimulation. Then we have bladder 37, 40, and 60. And the last one, you have a very chronic yin of the urinary bladder, yin deficiency of the urinary bladder. So we have to use REN-free, bladder 40, kidney 7, 4 local points with electro stimulation, bladder 37 and 60. Now, cold pain worsens with rest, worse when sitting or lying, disturbed sleep, worse on bending, morning stiffness for a few minutes, better with warmth and movement, gradual onset and progressive. So the bladder yin is very is in excess. Okay, so we need to sedate the urinary bladder using points bladder 63 or kidney 5. We vibrate kidney 5, 6 to 8 local hot needles, bladder 37. Next tower diagram, we have excess bladder yin with yang deficiency. We sedate bladder 63, sedate kidney 3, tonified urinary bladder 58, 6 to 8 local hot needles, bladder 37. And then we have deficient yang of the kidney of the bladder. So bladder yang deficiency. We use bladder 67, kidney 3, 6 to 8 local hot needles, bladder 37. Then we have damp pain. Worst at the beginning of movement from rest, morning stiffness lasting more than an hour. Both movement and pain improve as day goes on. Pressure, pain if sitting on the buttocks or thigh. So the first tower diagram, we have bladder yin excess or bladder, yin retention. Sedate the bladder using bladder 63, kidney 5, and we need to sedate the bladder yin. You're using bladder 63, kidney 5, vibrate kidney 5, 4 local hot needles, and dry cupping, stomach 40. Then we have kidney, we have the bladder qi deficiency and bladder yin excess. Sedate bladder 63, sedate kidney 3. So this is very yin, tonify, bladder 58, hot needles and cupping, stomach 40. And finally, we have bladder qi deficiency, bladder 58, stomach 40, always yin stagnation, so luo points, local hot needles, and cupping. So for wind pain, pain wandering between upper and lower back. If the lower back is better, then upper back hurts. If that is better, then the neck hurts, never without pain. So urinary bladder wind cold, few local points where it hurts on the day, bladder 12, GB31. Wind elimination, tonification, local moxa or hot needles. Urinary bladder wind heat, few local points with electrostimulation, bladder 12, GB31, wind elimination, sedation, SI7 vibration. Dump pain. There is yin excess in the chronic dump pain. This may not necessarily need yin sedation, but since it is a stagnation of fluid, it always needs to be circulated. Hence, the luo connecting point of the yang coupled meridian is used. This argument can be applied to damp cold pain, that is, a pain that is worse while resting and at the beginning of movement. Wind can be from exterior exposure or generated from the interior. If it is from exterior exposure, then the wind elimination points in the area applied with the wind elimination needle technique will suffice. If this is a chronic problem, it may be caused by interior wind. Liver generates interior wind, either in blood or yin deficiency situations. In blood deficiency, points REN13, bladder 15, bladder 17, GB39 can be used along with iron supplements. In deficiency, more likely in cases of wind heat, points liver 5, GB40 sedation, spleen 6 can be used to sedate the yang, which will ascend with the wind, and spleen 6 will descend the energy as a distal point of the lower warmer. Liver yin deficiency often goes together with kidney yin deficiency. This may be the reason that the back pain of wind heat manifests on the UB meridian. Tonifying kidney 7 would be useful. In the case of damp heat nature of pain, there can be two possibilities. So the first one, we have both yin and yang excess. This is an acute pain and has both damp and heat excess symptoms, such as pain during both activity and rest. Ideally, we should treat the causative factor and the reactive factor will reduce automatically. For instance, if the pain started after a fall or injury, the yang would have been the first to increase, but the pain would have increased the following day and it hurts now all the time. It would be enough to sedate the yang alone and the yin excess symptoms will be gone the following day. In osteoarthritis of the knee, the pain is often of a damp type, with edema and pain at the beginning of a movement. But if the patient walks excessively, it is possible that the knee will hurt more and become warm, and the character of the pain will change. Again, to sedate the yin of the meridian, give local needles, and cupping will work well in bringing down the inflammation. When it is not clear as to which energy increased initially, sedate both yin and yang. So the next tower diagram is a chronic state where both yin and yang are deficient and one cannot control the other, which means that sometimes one can increase and at another time the other can increase. The patient may manifest yang dominant pain if they walk or climb stairs and yin dominant pain when they sit or when the weather is wet, but not simultaneously. In this case, we need to tonify both yin and yang once a week and treat locally with electrical stimulation and dry cupping. Now let's talk about trigeminal neuralgia. This is a typical yang dominant and wind pain complicated by either cold or heat. Treatment becomes complicated when the patient is on high doses of pain medications such as carbamazepine. We have known patients who take 1,000 milligrams daily and go to work. Treatment is extremely successful, but the pain reappears each time the medication dose is reduced. Initially, dose reduction can be substantial, but we have to let the condition stabilize. Patients should be pain-free on the reduced dose before reducing again. The last 100 milligrams may or may not be possible to reduce. If it cannot be reduced, then it could be split into twice 50 milligrams per day. The first few treatments of acupuncture give the best effect if correctly given. We therefore try to reduce medication as early as possible so that the best treatments take effect when the medication cannot block the treatment. So general points, we use DO20 for tranquilization, GB39, influential point for the marrow, for the bone and nerve, GB20 with appropriate wind elimination needle technique depending on cold or hot symptoms, mostly heat. Treatment according to the three divisions of the trigeminal nerve. First division, gallbladder meridian. Local points, gallbladder 14 through to mid-eyebrow. Then the extra point Taiyang through to triple warmer 23. With continuous frequency electrical stimulation, 10 Hertz for 20 minutes. So for the acute case, the yang is increased. So we sedate the gallbladder 38 or 36, vibrate triple warmer 6 when local needles are removed. The second tower diagrams is subacute or recurrent. We have the hyperactive yang. Sedate GB40, tonify liver 5, GB44, tonify yin, vibrate triple warmer 6 when local needles are removed. And the last one, the last tower diagram, the yin is decreased. GB24, front mu point, gallbladder 44, the metal point, liver 1, own element point, all will tonify the yin. Now, second division for the large intestine meridian, local point, stomach 3 through to LI20, stomach 7 through to SI18, with continuous frequency electrical stimulation, 10 Hertz for 20 minutes. The first tower diagram is acute, yang is increased, so we sedate LI2 or 7, vibrate stomach 44 after local needles are removed. The second tower diagram is subacute or recurrent, hyperactive yang, sedate LI4, tonify lung 7, LI5 to tonify the yin, vibrate stomach 44 when local needles are removed. Then we have decreased yin or yin deficiency. We have stomach 25, front mu point, LI5, fire point, lung 8, own element point, all will tonify the yin. As long as local needling is too painful, the same points can be used on the contralateral side without electrical stimulation. Third division, stomach meridian. Local points, stomach 5 through to REN 24. Stomach 7 through to SI18. With continuous frequency, electrical stimulation, 10 Hertz for 20 minutes. So the first tower diagram, excess yang, acute. Sedate stomach 45 or 34. Vibrate LI4 after local needles have been removed. So for the subacute or recurrent, hyperactive yang, sedate stomach 42, tonify spleen 4, vibrate LI4 after local needles are removed. Then we have yin deficiency, REN 12, the front mu point, stomach 43, wood point, spleen 3, own element point, all tonify the yin. Treatment is given twice weekly most of the time, increasing to thrice weekly when the medication is reduced by a large amount. When the pain is settled with the new reduced dose of medication, there can be a short interval of about a week before treatment commences again and medication is reduced. After having arrived at the point of no painkillers or as few as possible, treatment should be gradually withdrawn. We would continue as once fortnightly for 2 months and once a month for 3 months. Now let's talk about dysmenorrhea. When treating the patient, we should ask them 2 questions, which would help us to correctly diagnose the imbalance. On which days of the menstrual cycle do you bleed most heavily? On which days of the menstrual cycle do you have the maximum pain? If the dysmenorrhea is worse on the days before maximum bleeding occurs, and there is colic and scanty dark clotty bleeding that is alleviated with heat, it shows the uterus has difficulty eliminating the blood. There is also a tendency for constipation and water retention prior to the period. The cause is that it is a liver function to release blood from the vessels, even if other organs are actually eliminating the blood. In this case, the liver function, the qi, is deficient and is not releasing the blood, while the uterus is contracting to let the blood out. This tug of war goes on for at least a day or 2, when finally all the colic and contracting of the uterus succeeds in increasing the liver qi. The blood starts to flow easily and is more fluid, and the pain eases. This situation between the liver and uterus is the main reason for endometriosis, where the buildup from the uterus which does not find its way out through the cervix, enters the abdominal cavity through the fallopian tubes, causing endometrial tissue to lodge itself in the abdomen. After the pain eases and blood begins to flow well, the stool and urine tend to become frequent and watery, and there is a noticeable reduction in body weight. The treatment is to increase the liver qi so that the liver and the uterus will work together simultaneously. So here we have a tower diagram which clearly demonstrates liver blood stagnation. The points, bladder 18, Backache point of the liver, improves function. Li4, great eliminator. Liver 4, metal point, also grandmother point, tonifies the yang. Gallbladder 37, luo point, sedates yin and tonifies yang, removes stagnation. Spleen 8 and 6, symptomatic points for dysmenorrhea. Paravertebral topping with plum blossom needle, lateral to lumbar 4 to sacral 4, until there is a red skin reaction. Top 1 centimeter lateral to vertebral column, both sides. The treatment should be given over 3 to 4 months, ideally during the middle 10 days of the cycle. 3 to 4 sessions within the 10-day period would be the best, and the patient is not treated during the menstruation. If the treatment is successful, the dysmenorrhea will be improved in the first month, vastly improved in the second month, and completely cured in the third month. So next is hyperactivity of the yang in kidney and uterus, the urinary bladder. This is when the period of maximum bleeding and maximum pain coincide. The patient has excessive red fluid bleeding with colic in the uterus, feeling of heat and flushes, an urge to pass urine and stool at the same time, and restlessness. The period can leave the patient exhausted, weak and dizzy, needing a few days to recover. Treatment, the points are REN 3, the front view point of the urinary bladder, tonifies the yin. Spleen 6, spleen 8 are symptomatic points for dysmenorrhea. Kidney 4, luo point, tonifies the yin and sedates the yang. Bladder 40, earth point, grandmother point, tonifies the yin. Liver 5, luo point of the liver, added if there is excessive bleeding. The patient should be advised to avoid refined sweets and carbohydrates and be more physically active during the 4th week of the cycle leading up to the bleeding. This would help the liver qi not to get sluggish. Patients should be advised to drink more water, avoid red meat, working near heat, and to sleep more. It is important to cool the system. Treatment can be given all through the month. Once a week is ideal. The patient should be treated for 3 to 4 months in all. Okay, so we now proceed to the wood element, the concept. So we have here tower diagrams. So for those who crave sour flavor, that's definitely liver qi deficiency. Craving bitter sour flavor, so it involves the heart and the liver. So there is qi deficiency. Craving sweet sour cream sour flavor, there is liver yin deficiency. Crave for butter, oily, fried, and cream sweet, liver and stomach yin deficiency. Symptoms worsening after sour, liver yang excess. Dislike or intolerance to milk, liver qi deficiency. Crave for sour but problems afterwards, and crave for sweet sour but problems afterwards. So liver, blood, and qi deficiency. Energy-giving color of the wood element is green. As the color of wood, all shades of green affect the energy of the liver and gallbladder organs. When one is tense or angry, it is very relaxing to take a walk in the woods or in a park. Operating theaters and the medical staff uniforms are often in pastel shades of green to help them manage their stress with ease. Deeper shades are generally yin in nature. They are cooling and calming. Brighter shades generate more heat and yang. This includes bright greens and lemon greens in wood element. Pastel greens improve the movement of energy or qi of the liver and gallbladder. Again, the strong likes and dislikes a person has during a particular time of their life gives us clues about their excesses and deficiencies. The body always tries to balance itself by either drawing energy from its surroundings or discharging energy to its surroundings. Colors are very therapeutic, and we can suggest appropriate colors to our patients so that they can continue to have therapy in the form of color while in their home or workplace. There are many patients who work at the computer for long hours. The artificial light irritates their eyes and causes a yang dominant state. Placing a plant with a lot of deep green foliage next to the computer is a very simple and effective way to counteract the artificial yang with some natural yin, thereby reducing the pathogenic effect. It is good to paint the walls pastel green in a room where there should be creativity and easy solutions. This will make the energy flow through the person without blocks, and no problem will be too hard to solve. For those who tend to overeat during stress, it is therapeutic to use dark green eating plates, a green tablecloth, and green plants in the dining room, so they do not confuse stress with hunger. Let's proceed to wood element diseases. Paralysis. Although the cause of paralysis lies in the nervous system, which is kidney-related, the effect is on the motor function. And therefore, we discuss it under wood. We are assuming that most patients consider acupuncture therapy after the acute phase of the disease has passed. Treatment should commence as soon as safely possible. Some examples of paralysis due to a peripheral nerve lesion: Bell's palsy, polyneuropathy, peroneus nerve palsy. In fact, any peripheral nerve can suffer from injury after long duration of pressure, mechanical or energy block in blood flow, causing flaccidity, muscle atrophy, coldness, and weakness. The reflexes are very weak or non-existent. If treatment is started as soon as possible, then results are very good, and recovery occurs after 2 to 12 treatment sessions. Treatment principles. Treat locally and proximal to the affected area, going as close to the vertebral column as possible. Thick needles and strong needle sensation is used because sensitivity is quite low. Local atrophy can be treated with acupuncture or with interval frequency electrical stimulation. In China, thread embedding therapy was used with thick catgut. The idea is to prolong the period of local stimulation so that the muscle mass can build up once again. Acupuncture, which is actually intramuscular injection of vitamin B12, 0.5 to 1 ml, lasts for a day, whereas the catgut can last 2 to 3 weeks. The patient can do exercises in the interval between acupuncture sessions to improve the results even further. So we discussed 2 examples of peripheral nerve paralysis. Facial paralysis. Treatment should begin immediately. If the patient is on steroids, treatment should start as soon as this medication is stopped. Through and through needling is used. That means the needle should be inserted at one point and pushed in the direction of another point. We can stimulate both points in this way. Ideally, the needle should be stimulated with intermittent frequency electrical stimulation. And if the needles are well inserted into the muscles that are paralyzed, an exaggerated movement of that muscle can be produced and continued for a few seconds with a short break in between. We can leave the stimulator on for 20 minutes, but the muscle soon tires and the contractions become shaky. In this case, one should stop earlier. Points to use are gallbladder 14 in the direction towards extra 3, the middle of the eyebrows. Stomach 3 in the direction of LI20. Stomach 7 towards SI18. Stomach 6 towards stomach 4. Additional points, we use gallbladder 20, Win elimination tonification, LI4, distal point, gallbladder 39, influential point for nerve marrow. At the end of the treatment, we could use plum blossom hammer tapping on the upper and lower eyelids. The eyes will close immediately after this. Treatment should be given for 2 to 12 sessions in all, depending on the rate of improvement. Peroneus nerve palsy or foot drop. So in Sri Lanka, we used to see this in workers in the jewelry trade who sat cross-legged on the floor all day while bending forward, thus pressing on the peroneus nerves. The palsy could be a symptom of pressure on the nerve by a prolapsed disc, or it could be as a result of a stroke. In both cases, it is not an example of peripheral nerve paralysis. But in the case of a polyneuropathy patient, this is a peripheral nerve paralysis. In every case, treatment is similar and the results are good. Again, electrical stimulation with intermittent frequency to make the foot-raising movement should be considered. Acupuncture, intramuscular injections of 0.5 to 1 ml, vitamin B12 injections could be given at the end of each session. Points to use are stomach 36, GB34, all points with electrical stimulation, 20 minutes, stomach 38, acupuncture on 2 points at a time, and urinary bladder 58. Up next is theory of the Sanfu organs, our third installment. Chinese medicine considers that differing climatic conditions influence specific organs. Heat influences the heart, wind influences the liver, dryness influences the lung, dampness influences the spleen, and cold influences the kidneys. An excess of these climatic conditions for a prolonged period may adversely affect the relevant organ. There are 2 types of internal organs, yin called zhang and yang called fu organs. The Chinese name for internal organs is simply zhang fu. Both zhang and fu mean organ, but an analysis of the Chinese characters can clarify the difference between the two. Zhang means organ, viscous. The character combines radicals indicating flesh and to store. This indicates that the yin organs are in charge of storing the vital substances. Fu also means organ. The character combines radicals indicating flesh and seat of government. This indicates that the yang organs are in charge of transforming food and drink to produce qi and blood, just as the government in ancient China was considered to be in charge of food distribution. The simple questions in chapter 11 says, the 5 yin organs store essence and qi and do not excrete. They can be full, but not in excess. The 6 yang organs transform and digest and do not store. They can be in excess, but not full. In fact, after food enters the mouth, the stomach is full and the intestines empty. When the food goes down, the intestines are full and the stomach empty. Thus, the yin organs store the vital substances, that is, qi, blood, essence, and body fluids. They only store pure, refined substances, which they receive from the yang organs after transformation from food. The yang organs, on the contrary, do not store, but are constantly filled and emptied. They transform and refine food and drink to extract the pure essences, which are then stored by the yin organs. As well as carrying out this process of transformation, the yang organs also excrete waste products. The essence of the yang organs is therefore to receive, move, transform, digest, and excrete. The functions of the yang organs are often summarized by the 2 words chuan and xing. meaning to transmit and to move because they are constantly receiving, transmitting, moving, and excreting substances. We move on to the water element, the concept. Part 3 of musculoskeletal pain. So we have a third clinical example for energy treatment of musculoskeletal pain. An elderly man came with shoulder pain along the right small intestine meridian, mainly at the scapula and on point triple warmer 14. If he sat or lay back on these areas, the pain increased, and he would also feel the pain down to the back of the elbow and to the dorsum of the wrist. He had the feeling that his wrist was swollen and blocked. He could not extend it well. He had had the pain for the past 6 weeks and felt it was gradually worsening and affecting his sleep and relaxation. So this pain pattern is seen in many elderly patients. If it is present in the left shoulder and scapula and could be mistaken for angina pectoris. Yet it is very simple to treat without medication. Diagnosis: damp pain on small intestine and triple warmer meridians. The patient had mainly pressure pain, worse when patient rested on the area of the pain, which indicated that there was some fluid underneath. He also felt that his wrist was swollen, although there was no visible edema. He could lie on the other shoulder without pain, which meant it was not worse during rest, but only with pressure. The radiation of pain was only present when he put weight on the scapula. So dampness was the cause and nature of the pain, which is a yin-dominant state. And since it was about 6 weeks since he started feeling the pain, it was a subacute state, okay? Which means that a yin excess and deficiency at the same time of the meridian. As the yin was in excess, the yang had to be deficient. Treatment: points triple warmer 14, SI 11, 10, 9, and 2 Ashi points along the small intestine meridian. SI 7, triple warmer 5, both Luo points that sedate yin and tonify yang on their meridians. Stomach 40, also the Luo point and symptomatic point to circulate dampness. After the local needles were removed, 4 dry cups were placed at the scapula and triple warmer 14. Patient was treated 3 times in 1 week. The pain disappeared in the first session, but the treatment was repeated to consolidate the results. We go to the 4th clinical example, still on energy treatment of musculoskeletal pain. We have a male patient, 37 years old, who came with a chronic low backache of over 6 years duration. He was treated 4 years back and had been free of pain until recently. He had had the pain for more than a year this time. The pain was exactly in the middle on the due meridian at the level of lumbar 4 to sacrum 2, and he experienced it only in bed about 2 hours after lying down in any position. He was then very uncomfortable in bed and even tried getting up and walking around, which seemed to help. He was also very stiff and had a great deal of pain in the mornings on getting up. He felt better within an hour with movement. He could not put on his socks and shoes in the morning, but had no problem later on in the day. His work required long hours of sitting at his desk and in his car. Diagnosis: due meridian damp cold pain. The pain was worse during and after taking rest. There was morning stiffness and limited mobility, which improved as the day went on. Cold pain worsens while resting and improves within a short time of movement that is required for warming up. Damp pain is due to stagnation of fluid. It is worse after long periods of passivity and needs a longer time of movement to improve the circulation of the fluid. Since the patient's pain had both aspects, it was a damp cold pain. As a chronic cold pain, the yang is deficient, as all chronic situations are primarily deficient states. As a damp pain, there is stagnation of body fluid. This means that the fluid in this particular area is more than at the other places. Treatment: warm the cold and circulate the dampness. 6 hot needles, 2 on the 2 meridian and 2 on either sides on the Hua-Tuo points. Extra 21. Cupping after the needling on the same area for 10 minutes. SI3, confluent point of 2 meridian to tonify its yang. Stomach 40 for circulation of body fluid. Do 1, luo connecting point of 2 meridian. Connects it with Ren, the coupled meridian, tonifies yang, sedates yin. Treatment was given twice weekly, but it was not before 8 sessions that the pain showed improvement. The sessions were then reduced to once weekly and continued for another 8 weeks. We now go to meridian theory. And this time we talk about the belt meridian, or the girdle or tai mai. This is the only meridian of the body that flows across the body with a belt-like flow across the hips. Common points of the belt meridian: gallbladder 26, 27, and 28. Confluent point, gallbladder 41. To use the belt meridian, all the above points should be used simultaneously, even in the case of symptoms appearing in half the body. We use the belt meridian for 3 important functions. For belt-like symptoms, patients often complain of backache that extends to the front of the body like a belt, or asthma with a tight sensation across the thorax, or a band-like headache. These symptoms will disappear with the use of the belt meridian. It is also good to use in half belt-like symptoms such as herpes zoster or intercostal neuralgia, which affects only one side. Number 2, for a sluggishly functioning gallbladder. When the gallbladder is not emptying well and stagnates bile, causing pain, distension, and greenish yellow stools after consumption of fatty foods, the points of the belt meridian help to speed up and make better the function of the gallbladder. When yin and yang, number 3, when yin and yang are going their own way. The belt meridian is the only meridian that flows across the body horizontally. All other meridians flow vertically from top to bottom. Because of this, the meridian is in a position to cut across and therefore link up the energies from 8 meridians of the body. These yin and yang meridians can communicate better through the belt meridian. Sometimes patients feel cold but show a red tongue with rapid pulses, and at other times there could be a hot and red-faced patient with slow and weak pulses and pale tongue. Or it is possible to feel cold in the interior but be hot on the skin, or vice versa. When the symptoms and the findings on examination of the patient contradict with each other, it shows that the energy in the interior and exterior are not communicating. In other words, yin and yang seem to be going their own way and not relating with each other. In such times, we are in a quandary as to which information we should rely on in order to make a correct diagnosis of the patient's energy state. The belt meridian can be used 2 to 3 times before we make a diagnosis. It will help the energies to mix better with each other and therefore make our treatment suitable for both the exterior and interior. And finally, we come to the last topic for the day: chronic fatigue syndrome. And this time we discuss latent heat. Okay, clinical tip for latent heat. Question: what makes latent heat emerge? Please note that emerging does not mean that the latent heat is being expelled, but simply that it is manifesting itself. Latent heat emerges due to one or more of the following factors: new invasion of wind, rising yang of spring that pulls it out, emotional stress, overwork, serious illness, medication, and drugs. How do we know it is latent heat and not just heat? The clinical manifestations of latent heat are indeed heat. So, how do we know that it is latent heat and not just an internally generated heat? There is no definite and absolute way of knowing that. The diagnosis depends a lot on the onset and history rather than the clinical manifestations. If we happen to see a patient at the onset of latent heat emerging, we know that it is latent heat from the acute onset. The patient complains of lassitude with acute onset, and he does not have exterior symptoms. So we exclude an invasion of an exterior pathogenic factor. So the acute onset together with the clinical manifestations of heat tells us that it is most probably latent heat emerging from a previous external invasion which did not cause symptoms at the time. If we do not see the patient during the acute onset, it is more difficult. How do we know that it is latent heat? First, we know from the channel location, which is either Shaoyang, not common, or Shaoyin, that is the heart and kidneys. Second, latent heat will cause vague, less specific clinical manifestations of heat than those of heat in a specific organ. For example, heart heat, stomach heat, liver heat. What difference does it make to treatment? The treatment of latent heat is not really different from that of heat. Latent heat is treated by clearing heat at the blood level. When treating latent heat, we also tonify the kidneys, usually only with 1 or 2 herbs or with acupuncture. What difference does it make to prognosis? It makes a big difference to prognosis. The treatment of latent heat is more difficult than that of heat, and it will take longer. Also, latent heat tends to cause difficult diseases like autoimmune diseases. Nature of latent heat. It has acute onset when it emerges. It is always heat. It may be with dampness. The heat tends to injure yin. The latent pathogenic factor that incubates in the body in winter hides in the membrane source, mohyuan, and is transformed into heat. The urine is an important diagnostic sign of latent heat. Firstly, dark urine is an important sign of heat that confirms the diagnosis of latent heat. Secondly, the darkness of the urine itself is an important gauge of the severity of the disease. The darker it is, the more severe. Latent heat can be in the Shaoyang or Shaoyin. One must distinguish its depth, severity, and deficient or excess nature. Latent heat in Shaoyang is Shi, in Shaoyin, Shu. Thank you very much for joining. We hope that you can join us again next time. Thank you.